Good afternoon and welcome. We'll be starting in just a couple minutes here.
Afternoon. Hello, everyone.
Hello.
Hello.
Everybody, we have folks joining us here. We'll be starting in just another minute. Okay, we're going to go ahead and get started. Welcome, everyone. Good afternoon. Thank you for joining us this afternoon. My name is Greg Smith. I'm with the Florida Literacy Coalition, and I'm joined by my colleagues, Heather Surency and Isabel Adamus, who will also be presenting today about this opportunity that we've been making available every year for the last 14 years, thanks to the generous support of the Florida Blue Foundation, Florida Blue and the Florida Blue Foundation. Our focus will be and is on health literacy and this application. And the focus of the overall initiative is to look at ways that health education can be integrated with adult education literacy, ESL, and family literacy instruction. So if we can go ahead over to the slides. Okay, very good. And if you can progress to the next slide, please.
It's buffering, hold on. Okay.
So why the focus on health and health literacy? Well, research supports that literacy is hugely consequential to health. And there's been lots of focus lately on the social determinants of health. And as this quote indicates from the National Patient Safety Council, that literacy and one's literacy level is among the most important factors influencing health status. So for those of you who are adult education literacy providers looking at health, as part of your approach to contextualized learning, can be really a win-win situation for students as they're developing their skills, but also gaining important information for themselves and their families with regard to health. Next slide. Now, health literacy, the definition that we tend to use and is used nationally is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. And we look at it in the context of clinical, preventative health, and navigating healthcare systems. So the clinical side tends to be filling out forms, patient forms and things of that nature, prevention, following guidelines for age-appropriate preventative health services. And then on the navigation side, understanding what health insurance is, how to pay for it, how to access and navigate your way through the healthcare system. Next slide. This is older data. Unfortunately, it's the most recent that we have. But back in 2003, as part of the National Assessment of Adult Literacy, they looked at health literacy as a component of that study. The more recent studies that have come out, it's called PIAC, doesn't have that health literacy component, but the literacy data is very comparable. So I think that this is still fairly accurate. And we wanted to just give you an understanding with respect to the extent of the problem and the tie between literacy and health literacy. So for those folks who have below basic health literacy skills. Those are folks who struggle to do things such as circling the date on a medical appointment form or a hospital appointment slip. And that constitutes about 14% of the US population. For those who are at the basic level, folks who would have difficulty giving 2 reasons for a person should be tested for a specific disease based on information in a clearly written pamphlet. So that just kind of gives you an idea as to what would be some of the struggles as it relates to health and healthcare. And our program and the students that are served do tend to sort of fall into these two areas that represent about 36% of the US population. But it represents a higher percentage of the folks that we are serving in all likelihood. If you can move to the next slide, please. So as you can see here, in terms of the folks who have not graduated from high school, the percentage of people who are at a below basic level is significantly higher than the comparable general population, about 3.5 times higher. For those who did not speak English before starting school, also significantly higher, about 3 times higher than those folks in the general population. And as you can see, there's a number of other sort of demographic categories here where health literacy does tend to disproportionately affect minority populations, older populations, and so forth. So I think this is a really strong argument that it's a great fit for adult education and literacy. Next slide, please. So people with poor health literacy skills, there's a lot of good research out there. We just pulled some statistics. Folks with poor health literacy skills are more likely to have chronic diseases. They're less likely to get the health care that they need, have an average of 3 times more prescriptions filled than adults with higher literacy skills, twice as likely to be hospitalized, and unfortunately also have shorter life expectancy. One of the things that's an unfortunate reality related to that is that some people with low health literacy skills, and this is not uncommon, would rather not seek medical help than to admit that they have struggles when it comes to reading and writing. So that's a real barrier. So what are we doing to try to address this? Well, the Florida Literacy Coalition, again, in partnership and through the support of the Florida Blue Foundation, have worked with multiple organizations, and I know some of them are here represented on this call over the years since 2009, to integrate health education in a comprehensive way into adult education, literacy, ESL instruction. Part of what we do, in addition to providing grants of up to $5,000, is we also provide support services in terms of training and resource sharing to the programs that are funded, and to other programs that don't opt to necessarily go for this grant, but are still integrating or are interested in integrating health literacy into their work. So we'll be sharing here in a bit some of the resources that we've developed, and we also look to a lot of good resources outside of our organization and share those with programs across the state. We provide real-time training as well as online courses, and just as many resources as we can find that would be helpful in successfully implementing these programs. And part of what we do too is bring the grant recipients together quarterly to share what they're doing. And that's really one of the most informative things, I think, to really learn from one another. We've awarded these grants to more than 75 organizations. So I think we've covered pretty much every area of the state at this point. This initiative, I'm pleased to say, has now served over 24,000 students through our local program partnerships, and more than 390 community partnerships have formed. And there is a big emphasis on partnerships as part of this initiative. Next slide. This is These are our current grant recipients. To give you an idea of folks who are funded, we traditionally serve or provide grants for 14 organizations. So you can see it's cross-representation. We have community-based literacy organizations, libraries, school districts, and community colleges, all as part of the mix here. And these are grants that are renewable. So if you are funded, you can renew or you can reapply the next year. So we have a number of organizations that have been funded over multiple years. Next slide. So this slide shares a little bit in terms of some of the outcomes, and that's really at the core of what we're doing. How does this kind of programming, or does this kind of programming help individuals, and if so, how? So we do collect data. We do a health literacy, pre and post health literacy assessment, as well as a survey for participating students. So of those who took the pre and post assessment, 71% last year improved their literacy skills by an average of 33%. So it's pretty high impact there. And then through the surveys, we ask in terms of whether what they've learned has been applied, or if they've applied that in their daily lives. And we are seeing and have over the years, this has been pretty consistent over the years, students exercising more, eating healthier, learning, to really specific things around learning to read medicine labels and other materials that are relevant to their daily lives. Communicating better with the doctors. 100% of teachers report that students are better prepared to ask questions for their doctors. Not included here, but I wanted to share that programs also tend to report that student retention and their educational gains are as good or better for this classes that have this focus as compared to their general population of classes. Again, we're big believers in contextualized instruction. So taking this approach hopefully is a real win-win situation as people are gaining information that's useful in their daily lives. And with that, I'd like to now turn it over to Heather to take it from here. Heather?
Thanks, Greg, and welcome everybody. So glad you could join us today. I just want to spend a few minutes kind of talking about our program, and as Greg was illustrating for us, what makes it so special. The results that we see are frankly amazing because we're able to help learners learn so many different skills along with the health information that they're gaining. So we do that through this contextualized instruction. So we're building English language skills, we're building literacy, numeracy skills, and digital skills, as well as helping to build people's confidence, their ability to critically think about all information, specifically health information, what is good, credible information, what might be scams, or what might be information that is not based on research. So there's so many different skills that adult learners can gain from being in a health literacy class or a health literacy program. So we really kind of focus on that infusion of gaining the skills and then gaining the information. And you may kind of wonder, well, how does a instructor do this without being a health expert? And that's kind of, Greg touched on this, but this is where the partnerships are really important. And then also the materials that we provide. A lot of the information is very basic information that most instructors with a bit of training, and Isabel will talk about our tutorial program for instructors that we have online. Most instructors feel pretty confident in being able to convey some information. We'll talk about that a little more as we go along. Next slide. So Greg mentioned retention, and definitely being able to tap into what adult learners are motivated by and interested in really can help them be enthusiastic and excited. And that's some of the feedback that we get from grantee programs, is that their students love their health literacy classes. Family health specifically is a motivating factor as well. We find that many people share the information that they learned with their families, with their communities, with their friends. And really, when we look at the research on health behavior change, we see that people are more effective at changing habits, gaining or adopting new habits when they have the support around them, right, of other students, of their family, and of their friends. So that really can help, again, with retention, and then just helps people in the acquisition of their language, literacy, and numeracy skills. And these are some pictures as we go along. These are actual pictures that grantees have sent to us of the different types of projects that they do, just kind of so you can see on the left, 2 pictures, you can see those are CPR classes, which are pretty common among our grantee organizations. Gives adult learners a fantastic opportunity to learn more about the human body, obviously become trained in CPR, which is so important, and then also receive some receive a certificate so that can be a great builder as well. On the right, you can see a picture from a community garden. This is another really common project. Florida is such a great place, right, to do gardening, you know, almost year round, except in the middle of the summer. And so by doing community gardens, learners can, you know, experience so many new skills. They support each other. They learn about healthy eating. They also learn about gardening. And we'll talk about some of the resources as we go along too that are available. And that's another really exciting thing, is that there are so many community resources, community experts who are out there waiting to assist you in this program. So that kind of leads to our next topic, which would be those promising practices and partnerships. One thing that we have found is important in successful programs are project-based learning activities and opportunities. And project-based learning, again, you know, some of the things that I just talked about is really important for developing both soft skills like communication, confidence in speaking, developing presentations, for example, or, you know, increasing your digital skills. So there's a lot of skills that students get from project-based learning, but they also are, you know, thinking about how to solve problems and thinking about how to educate others in their school or in their communities. So there's a lot of really good research behind using project-based learning in health literacy as well as in other aspects. And there's some great resources and ideas on how to do that. And then also, as we mentioned, those community partnerships are key. We don't expect people to be experts in the area of health, but there are a lot of experts, as I mentioned, that are so motivated and interested in helping people along. So through our curriculum and our materials, we definitely can cover the basics. And then if students are interested in other topics, that's a great opportunity to reach out to, you know, Florida Department of Health or poison control, CPR instructors, hospitals, healthcare clinics. There's just so many different partnerships that are really important for learners to know more about what's available in the community and also to increase their knowledge base. So some of the resources that I mentioned, Isabel, do we want to go online and take a look at a few of these?
We can look at them.
So I'll just pause for a moment.
The bar, okay, I can move it. So this is an example of our Staying Healthy curriculum and resources, which you can download for free, or if you're a literacy provider in the state of Florida, you can contact us and order physical copies for your organization. So you can see here where you can download by chapter or the entire book. We also have, it's linked here, our resource collections. This is part of a project we worked on last year. It's created by adult educators, and it's a free resource library for our Staying Healthy and Staying Healthy for Beginners curriculum. So you can access these, and people in your program or teachers can use this, and it's supplemental resources. It has different activities you can work on with your students, and a lot of them are online, such as Quizlet or, you know, different videos, and it's a great resource and it's all free. And I think that was the main ones I wanted to show. We also have an online,
Can you go back just to the curriculum real fast?
Yes.
Online, thanks. So also on there, she pointed out definitely you can download by chapter, download the whole book. We also have a teacher's guide available for all of our titles, including, she said, Staying Healthy for Beginners, Staying Healthy, what we kind of call the blue book, which is our intermediate book. We also have a Coping with Stress curriculum, health careers curriculum and a women's health curriculum. So for all of those, we have a teacher's guide too, which provides discussion and talking points, activities, really helping instructors, step by step to introduce these topics. Also, you can see below that we have some specific videos too that address many of the common topics that are covered by our instructors. Also, for literacy organizations in the state of Florida, you can request print versions of almost all of our titles at no charge in limited quantities. So we have a grant from the Florida Department of Education to assist with that. So on our website, you can request those books as well, whether you're a grantee or not. Again, if you're a Florida adult literacy provider.
And also our Florida Literacy Conference, our annual conference in May, has a health literacy track. So that's also a great opportunity to learn more about health literacy through your organization. And if you become a grantee, you also are expected to attend the conference.
Heather, you may want to touch on the career guide too. That's a good supplement, I think.
Sure. So there's definitely been more and more attention, placed on helping adult learners to progress on into different careers. And in the state of Florida, we have a shortage of healthcare providers. So this is a fantastic opportunity for our adult learners to kind of move into that area. So we have this Health Careers Guide. It is available in print, but really we developed it to be an online ebook that has a lot of different links and videos to help people know more about health careers that require 2 years of education or less. So we have, jobs in that guide that may have no training whatsoever, again, all the way up to 2 years. And we talk a lot about what pay is, what training is, the different kinds of training, illustrating the link between additional education and additional or higher pay and benefits. So it's a great way for you to satisfy, kind of some of those requirements in the area of helping adult learners see what could be, ahead for them once they move through your program. And we've gotten great responses. Students seem to really love it. And really there are health careers for everyone, not just clinical jobs. There's administrative jobs. There's jobs where you can work at home. There's jobs where you work in a hospital. There's jobs, that are more IT focused. So there's so many different ways that people can join the healthcare field. So just to talk a little bit about our grants more specifically, as Greg mentioned, we will be awarding 14 mini grants of up to $5,000 each this year. The awards do occur usually in April, with the start date being May 1st, and then runs through April of 2024. Sounds crazy to say. The requirements to be a grantee must be a 501c3 nonprofit organization or government-based organization or agency that provides adult ESOL, adult literacy, and or family literacy instruction in Florida. When you look at our results, you can see again, how much knowledge and skills that students take away. And that's because most grantees spend a significant amount of time teaching about health literacy. So our grantees don't just do a few hours. Most of them do an average of about 20 hours per class, some a little bit more, some a little bit less. And that's really, I think, what makes us unique. Florida Blue is really proud of our program. And I think that that's why, because we kind of have quite a unique way of teaching about health and health literacy and allowing students to learn new information and then practice it. And, when we have that repetition, it tends to really show in people's pre and post surveys. So we provide, we have grantees that are providing literacy services via classes, small groups, or one-on-one tutoring. So as Greg mentioned, we have grantees that are coming from school districts or coming from nonprofits. It really just depends on the organization. We just require that they are providing these literacy services, and are able to have health literacy classes that again are, longer than just a few hours. We also ask grantees to commit to basic reporting requirements. So we have a pre and post knowledge assessment that is given at the beginning and end of class. We also have a student health behavior survey. Greg showed you some of the data from that. And that really is a self-report survey where students can say, you know, what changes that they have made and what they feel like they have learned. So it's great feedback for instructors as well as that pre and post. And then we also have an instructor survey where we ask instructors to give us a little more information about the resources that they need and kind of the changes that they feel like they saw in their students. And then we also have 4 quarterly grantee networking meetings. As Isabel mentioned, the first one is at our Florida Literacy Conference that we hold annually, usually late April and in May. This year's in May. That's kind of our orientation where we all get together and meet each other and go over all the requirements of the grant and start to share some resources. It's also a great opportunity to network with a member of the Florida Blue Foundation as well, who typically attends that for us. So just to define family literacy real quick, because we often get questions about that. Our program does focus on adult literacy. So family literacy may be kind of part of that, but really we're focusing on how adults could be working with their children or teaching their children versus focusing on instruction of kids. So, you know, interactive literacy activities between parents and children, training for parents, and then age-appropriate education for children would fall under that definition.
So to go a little bit over the application, so the application materials are posted on our website, and I'm going to link over there real quick. And that'll include the online application, a document to go over some guidelines, a checklist, and frequently asked question page. The application is due February 6, 20 of this year at 5 p.m. and all materials must be submitted electronically. So I think Heather can post the link to the application page in the chat. So this is what it looks like. And here you'll click to submit the electronic form. This year it's on Jot forms. This is what it'll look like. And you'll just plug in information about your organization. And we ask, you know, the person, you also include the primary contact if you were to receive the grant, so we can know who to properly contact. And this is just some basic information about your organizations. And then you'll upload the other documents that are part of the application, such as the narrative and budget. And we ask that you submit those as PDFs because it's just easier for us to download and look at. And then you'll also be asked to include supporting materials, and it's limited to 2 pages. So if you do submit more than 2 pages, we will just cut it off at that point. And so this is what it looks like, and you can download these documents, and this is what the application will look like. Again, it has that Jot form link where you will attach these supplemental documents to the online survey. So I'm gonna go back here. Sorry, I have to keep moving this bar. So again, I showed you where the Jot form link. This is all included in the presentation, so you can have access to it later. And so a little bit about our narrative guidelines. We ask that you include a project abstract, so a basic summary of your goals, history and accomplishments of your organization, so we get to know a little bit more about you. A needs statement, so that'll include like the populations you served and major issues and what you hope to accomplish with your project. And then objectives, we ask that you make these clear and measurable and include like anticipated number of students you expect to serve and the amount of instruction. And we typically say that you average 20 hours of instruction. Also a project description, collaboration and partnerships. So who are you planning to reach out to or work with in the community, or any existing partnerships your organization currently has. For recognition, how you plan to recognize Florida Blue, which sponsors our grant. Your timeline, and then evaluation. So how you expect to measure your objectives and outcomes for your grant process.
And let me just add that the extra evaluation is optional because, as I mentioned, we do provide you with some evaluation tools, but some organizations have their own evaluation that they like to do. So we just allow you the opportunity to tell us if there's extra things, but again, that's optional.
And then we also ask for a budget proposal. So this is what it will look like in the application you download. And so it should include your revenue, project expenses, additional expenses, and any in-kind resources. And we ask that you be very clear with this, just so it's easier for the committee to better understand how you're going to be using your money.
Exactly. So if you do have in-kind resources, that's great, or additional budget items, but we want to see specifically, or the committee wants to see specifically, how the $5,000 will be spent. And just make sure that it links back to your narrative, because sometimes the committee will note that there's something in the budget that was not discussed. So they do tend to kind of look at that. And then also double check, triple check that your budget adds up. Sometimes, unfortunately, people's budgets don't add up. And so that sometimes is noted by the committee as well.
I think it's also worth noting that the in-kind resources certainly can enhance your application, but there is no match requirement for this. I know some grants have, that the local organization needs to provide a certain amount of the funding for the project, and that's not a requirement here. And in case it wasn't mentioned, this whole thing in its totality is 5 pages. So, we have, had a pretty short application process. And for those of you who have applied before, or current grant recipients or prior grant recipients, I just want to let you know that we really didn't. This application is essentially the same with very small modifications from last year.
And so to submit your application, like I showed you, this is what our JOT form, which is our online survey, looks like. And so you'll fill out that narrative and budget. Like Greg said, it's a 5-page limit, and then any supporting documents as PDF files, and you'll upload that to the online JOT form survey. And so like Heather mentioned a little bit earlier, as requirements for the grant, so our basic reporting requirements, we ask that all organizations collect pre and post assessments for students, and those can either be done on paper and Scantrons, or we have an online option for organizations if that's easier for you. We also have the student health behavior survey, which students will take at the end of their class, an instructor survey, and then we also ask that you submit a brief mid-year report and an end-of-year report. And the end-of-year report typically that's when you will send us your pre and post assessments, either by mail or online. Do you have anything to add, Heather?
Yeah, and we do require a minimum for the pre and the post of 40% completion rate. We hope for it to be higher as well, but this data is required by Florida Blue Foundation. So that is just something to note, that we assist however we can. Some programs find it to be a little bit difficult, but we have some strategies to help with that, such as offering incentives or other types of things like that. But these are required as part of the grant program.
Yes, and if you ever apply again, it's definitely something we look at because that data is really important to us. And if you ever have any issues, you can always reach out to us if you need support in getting those assessments filled out, or if you're experiencing barriers. That's also something that's really important to include in your mid-year, end-of-year report, so we can get a better idea as to why maybe lower one year.
If folks are interested in seeing the pre and post assessments and the survey, those are available on our website. So they tie with sort of core fundamental health components that are part of the Staying Healthy curriculum. We don't require that use the Staying Healthy curriculum, but just about all the organizations typically do that. But of course, you can supplement that as well, and we encourage you to use other resources and supplement as well. So to supplement. So I do think that it would be probably good to go in and take a quick look at what those tools look like, and so you'd have a good handle on what the requirements are.
And we do have a beginner assessment and an intermediate level assessment, so a shorter and a longer one. And we do have them available in several languages as well, because for the pre and post, we're not trying to necessarily test their understanding of the English language. We're trying to assess their knowledge about health information.
And I know we have several folks here who are grant recipients currently. And so I'd like to open it up. And if you don't mind, Kathy, maybe I can pick on you, Kathy Severson from the School District of DeSoto County. Would you mind saying a few words about your experience? I know you've had a grant for a number of years.
No, I don't mind at all, Greg. Thank you for the opportunity. We have been very fortunate to have received this grant for a number of years and have found it to be super beneficial and enjoyed by our students. For our student-based learning activities in the past, we've done a garden, as which Heather referenced. We've done mock doctor visits with our students and our LPN students. We're fortunate we have nursing program on our campus, so our students are actually able to role play what it might be like when they go to see their doctor. We have set up a rotation with our local blood mobile, so they come to our campus. We try to get them in once a quarter. We have brought back our 100-mile walk, where every day students are invited to walk around campus for about 15 minutes, and we provide some incentives along the way. The first to reach the 100-mile mark receives that blue ribbon. So we have a lot of fun with the program and are certainly appreciative of it. And it's enjoyed by teachers and students. So I can't say anything bad about it.
Okay, well, thank you. I appreciate that. And one thing I did want to mention is that we do have some examples of some of the projects that organizations have engaged in. Kathy just mentioned some really cool ones that they've done there in DeSoto County. So if you're looking for ideas, we don't require that you have that all set before you apply. You can just reference that you'll be working with your students to do that, because a lot of programs, and we do encourage programs to engage their students in that process, to select a project that really is meaningful to them. So there's some really neat examples, I think, of some of the creative projects that organizations have done over the years. And I also wanted to mention that these funds are pretty flexible, to work on. You use those for the projects. You can use them for at least a certain amount of it for, events and food. And, the dollars are a little bit more flexible than you might find with some of the other, grant sources. Is there anybody else here? I know we have several other folks. Anybody else would be willing to say a few words about your experience?
Well, and I just want to say Heather actually posted a link to our website that shows some student projects, and I'm sharing my screen right now just so you can see things like community gardens, CPR classes, different experiments or leading science fairs, and field trips into the community. So people have gone to visit things like Publix, local farms, local Florida Blue Center, or your local hospital, fire station, and like mentioned earlier, like having different health contests to motivate students to work together, health fairs. So you can look here and just get a good idea. There's some images and links that are really helpful.
Joe Sinney from Learn to Read in St. Johns County. I just want to echo that. Fortunately, a few of those pictures are from us, so that's nice. We've had a lot of success. We thank you very much for all the opportunities. I think one of the other things that many of the recipients probably would acknowledge is the partnerships that you develop with a lot of different organizations has really been tremendous. It allows for a lot, to extend your outreach a lot further than what you could do on your own.
Absolutely. Thank you, Joe. Well, let's open it up. If anybody else wants to comment, that's fine. And let's also open it up for questions. So any questions that folks have? And you can either put that in the chat or just unmute yourself and ask the question.
Hi, Greg. It's Christine Briggs from Collier County.
Hi, Christine.
How are you? I'm not too sure if there's any new people online that want to go for the grant, or if we are all returning. But I highly suggest if you are thinking about applying for this grant, it's basically the way that I look at it. Well, lots of different ways, but when you think about $5,000, what you can do with that money to help support health literacy, it's like winning the lotto, and the students highly appreciate it as much as the teachers do. And it's really, the ball's in your court. Whatever idea that you have, you could just roll with it. And I love that freedom that we have with that.
Great. Well, thank you for sharing. And you guys do some really creative stuff there in Collier County. So glad to
And I
have you.
think that's a great example that Christine brings up. She's from a school district, so her funding needs might be different than a community-based organization. So really, it's kind of helping you manage this program in the way that you need, whether you need staff funding or staff support, or whether you need some extra things that, like Christine said, you just can't typically, fund through your normal budget.
Yeah, this is Travis from Flagler Technical College, and thank you all for doing this presentation today. We've been a grant recipient for several years, and what Heather just mentioned is absolutely 100% spot on. I mean, we would be teaching health literacy as a component of our program anyway, just because it's a valuable resource for the students to have. But one of the main struggles that we all have is budgeting for staff. And a large part of what we end up having to do with the grant, and where that helps us the most, is actually being able to help fund that time that we are specifically working with students on health literacy. That's just huge for us. And it shows that the curriculum is fantastic. I wish there was something as put together for the financial literacy as that, because we would be jumping on it like crazy. But I love the financial or the health literacy curriculum is just fantastic. We use it at beginner and intermediate levels, and the students just gobble it up. They absolutely love it, and it's almost alarming to face that realization that we take for granted so many things that we just know how to do, where these students coming, especially fresh out of other countries, their entire healthcare system is completely different. They have no idea what they're facing, or what they even have to do to just get a help from any kind of medical resources in the United States. So it's immensely helpful. So thank you all so much for everything you put together. But that's what is the most help for us, is utilizing some of those resources just to help with the staffing to be able to teach what we would have been teaching anyway. But that's immense.
Great. Well, thank you, Travis. Well, I think we're down to the last 2 minutes here. So one last opportunity if anybody had a question. Otherwise, we'll wrap this up. I did want to mention that Isabel has put in on the chat the direct link to the application page, as well as this presentation with links to all the resources that have been mentioned. So hearing no other questions, I want to thank all of you for taking time out of your day to join us today, and do look forward to hopefully hearing from you for this application process. And we look forward to working with you. Thanks a lot. Have a good afternoon.
Thank you.
Thank you.
Thank you.